Losing the pregnancy you have always dreamed of is devastating and can affect every part of your life and your partner's. Miscarriage is the loss of a pregnancy between 6 and 20 weeks, and most which happen between 6 to 12 weeks, what we call the first trimester. Often there is no clear cause and supposed to be just bad luck. Every pregnancy loss is highly personal matter, and there is no right or wrong way to feel about it. You don't need a diagnosed medical cause to come to accept what has happened, although in some cases it may help to put an end to the endless self-questioning that some women may experience during this time of grief. Common reaction is initial shock, which may give you to long term of grief. This mentally drains them and makes them feel unmotivated to do the very thing that may help, which is to try again. Most women are concerned about the chance of becoming pregnant again, and once successful, the anxiety about suffering another loss might prevent them from enjoying the pregnancy journey. It can be comforting to talk about your feelings with your doctor or someone close to you. There are no rules around the grief following a miscarriage, and everyone acts differently. It can't be like grieving for someone whom you knew, but rather a sadness about the loss of the baby's future and yours with the lost potential child, or sadness of not knowing whether there will be another chance of pregnancy in future. The experience can be just as painful for those who already have a child. For those who lose a pregnancy after successful fertility treatment, there is the fear that the treatment might not work again, particularly if finding success was challenging to start with. Most of the time, attention and focus of empathy is the female partner or the carrier. However, it is important to appreciate there is a partner going through similar grief, even though the expression and experience could be different. It is important to realize that whatever you feel after a miscarriage is you're not alone, and it is never your fault. One pregnancy in 7 can end up as a miscarriage, raising to 1 in 4 in women older than late 30s. Although it may be of no comfort at the time, most miscarriages are due to sporadic chromosomal problems. However, in small percentage of cases, there is a problem hardwired into the chromosome makeup of one parent, so chromosomal analysis is an important test, especially if there has been other pregnancy losses. Unfortunately, it is estimated 5% of women experience 2 or more consecutive miscarriages, and about 1% experience 3 or more what we call recurrent miscarriages. This is one of the most challenging situations for patient and the clinicians alike. It is important to carry out relevant investigations to identify correctable and treatable causes of recurrent miscarriages. No apparent causative factor is identified in 50 to 75% of those cases. Important point is to emphasize patients who suffer from recurrent miscarriages that the chance of future successful pregnancy can exceed 50 to 60% depending on the maternal age. What is most helpful, I find, even as a clinician, is to acknowledge the emotional challenges that they encounter and providing tender loving care and being supportive. This hopefully will give them the courage and be brave enough to try again.